Good afternoon, everyone. Welcome to COVID-19 and trauma training. We are excited to have you all with us today. Just a couple housekeeping items before we get started. Good afternoon. My name is Amy Julian. I am the director for the Illinois Center for Specialized Professional Support, and we're at Illinois State University. We're here today to bring you this very special part of WIOA professional development, but very special webinar on COVID-19 and that intersection of COVID-19 and trauma. And with that, this is a session that is today. It's a 2-hour session. And in addition, we will be repeating this same session on August 20th. So we hope you are able to join us today and then tell your friends so they can join us on the 20th. All attendees are in listen-only mode, but we do give you a couple ways in which you can interject and talk with us. If you would like to raise your hand and feel that your microphone is working adequate, if we pause, you can participate that way. In addition to that, you are able to post any questions in the question box. And I do want you to be sure you go down and see the handouts. There are 4 handouts for us today in the handout beacon there. So this presentation is available for you, as well as Straude, Hoffman, some other stuff that I'm sure Ashley will get to here in a second. So without further ado, I'm going to hand the floor over to our presenters today and let them tell you about this great session that we're doing.
Excellent. Thank you so much. Good afternoon, everyone. My name is Ashley Hamilton, and I'm the program manager at the Chicago Jobs Council. For those of you who may be new to the Jobs Council, just a little background real fast. We're a 39-year-old member-based organization whose mission is to help people out of poverty through access to quality employment. Now, our name is a little misleading. We are not a direct service agency, but the way that we go about this is doing policy advocacy at both the state and the city level to remove systemic barriers, keeping people from access to quality employment. And then we also do this through our capacity building initiatives, such as the Frontline Focus Training Institute, which offers trainings like this to make sure that individuals such as yourselves who are on the front lines have all of the tools and resources that you need to be able to help your participants end up in quality jobs. So today we're going to be talking about COVID-19 and trauma, and we are very fortunate to be joined by ICOY, the Illinois Collaboration on Youth, and my colleague Jocelyn Vega, who's going to introduce herself and actually be your presenter for today.
Thank you so much, Ashley and Amy, for starting us off. So my name is Jocelyn Vega, as Ashley just mentioned, and I will be your presenter today for COVID-19 and trauma. And with this training, it's something that's still ongoing, right? When we think about trauma, as service providers especially, we can think about it, what's happened in the past, but really with COVID-19, we're still in this present moment, and it's still ongoing for right now, right, nearable future. So in this training, what's the intention behind this training is really having an opportunity to land as service providers and recognizing that we're people in this global moment. So when I'm presenting this, it's really going to be understanding what is our personal relationship with trauma, as well as the context of COVID-19. We're going to be listing and moving through a lot of traumas that might be very personal and very subjective. And we're going to see how it relates, right? How all this relates to trauma that we share in our lives, but also what our students, youth, communities, and society is balancing at the same time. As a trainer, I'll introduce myself and a little bit of my background, but really my goal here is to not only recognize the trauma, but also balance that in that second objective of how do we develop or even recognize that we're developing coping mechanisms and self-care strategies. As the next bullet point with objectives, we're really going to talk about the disproportionate impact of COVID-19 and how that's marginalized us as well as marginalized communities due to existing structures of oppression. I also just want to move forward with the other objectives and things that we're not covering in this presentation. So we got an X here, and we're not providing a medical overview of COVID-19 along with its signs and symptoms. We're not going to be providing nonprofit funding resources as well. And before we move forward to the next slide, we're not going to be reviewing the government policies and practices as related to COVID-19. Like, this is really a personal, reflective, subjective presentation. And that can be a lot to balance as an audience member, especially since we're not together in a space and we're doing this virtually. Me as your trainer, I just want to recognize that this is a lot of work. This is a lot of effort just to listen to someone discussing trauma, connecting that with yourself, or maybe how it doesn't really connect with you right now, but that attention that you're sharing, I just want to honor that. I want to respect your time because you are here. And I also just want to say thank you, right, as my objective as your trainer for trusting me with your time. And in this, 2-hour webinar, really I'll be offering information for you, right? And I'm going to be offering that information from an empathetic mindset. So just being compassionate, trying to look at it holistically. So that's where I'm coming at, what I'm trying to do. And we can move forward. The next slide, thank you, is we can't see each other, right? But this is who I am. My name is Jocelyn Vega. I work at ICOY, which is Illinois Collaboration on Youth. And we're a membership agency that works with service providers and youth and families. And my specific role is a trauma specialist. So we have a whole trauma team that researches, organizes, and creates training and support, like technical assistance, to really discuss what is trauma, how does it overlap, extend from a historical perspective to this present moment. I have my contact information here, so feel free to reach out. And in this training, I just want to give you a heads up of what's the flow. What are we doing here today? So I'll be reviewing a few sections, and at the end of each section, please know that you can always share your questions. If they're general questions, specific questions like, how do I do this, in my agency? How do I do this when I'm interacting with youth? What are the specific steps that I can be engaging with? You can ask those questions at any point, and at the end of each section, Ashley's going to help me review what's in the chat box and what's been asked. So we'll slow down after sharing information, discuss before moving forward with the next section. So just to give everyone a heads up, please share throughout this presentation. We'll definitely make sure to catch it and to share it before we transition. So with that, I also just want to move forward and ask, what are your objectives? And this is really an opportunity for people to share in the chat box, take your time. What do you want to do today? What's one thing you hope to take away from this training? What is something you've been balancing or navigating within your role or your personal life? Or those two are highly interrelated, right? So there might not even be a distinction. So please take this time to, in the chat box, right? You can also personally reflect on what that is. And just letting people let that sink in. I'm just going to discuss, as you're thinking about that, I'm going to discuss self-care. So we can transition to the next slide. But everyone, feel free to chat. That is still open. I'm just going to be talking through some things as people are sharing. So one of the biggest things we believe at ICOY, and as well as being trauma specialists as your trainer today, is the importance of a self-care check. So all of us who are here, we're here as ourselves, right? We're here as individuals, we're here as service providers, we're here as people. And one thing I want to say is that talking about trauma can be traumatizing. It can be overwhelming. Having a language, having a space, especially if it's a concentrated space, right, where we're only discussing this in details and examples, it can move us in so many ways, and it can open up ways we've been moved because of this trauma. As well as COVID-19, right, as a specific trauma as we're talking today, is still ongoing, and it's going to impact us or has impacted us. So I just want to give a warning, and I'm going to do my best to give warnings throughout this training that it might be highly triggering for us. Even as a trainer, right, I always check in with myself during the training because this is our present moment. So some things that I just offer that I just want to share for everyone here, and thank you again for being here, is something I really believe in, and giving yourself grace, giving yourself permission to feel, to, take a break or log off as needed, right? This session is going to be recorded. So giving yourself the patience, the opportunity to be graceful with yourself, to forgive yourself, to, see yourself and move with that, right? But sometimes you got to apply the brakes and log off, or go on a walk, or, you know, get that glass of water. So anything you need to do in this session, in this training, please value that and honor that. I only want that as a trainer, is for you to see yourself during this time, as well as breathing. When we're stressed out, and especially when we're experiencing trauma, our body has physiological reactions, right, to stress, to pressure, to our mind racing, that sometimes we're only breathing in our upper chest and we're not breathing fully. We're not fully expanding our lungs because we're mentally and emotionally racing inside of our bodies. And we might not always recognize that. So, you know, throughout this training, just remember to breathe, slow down, right? If you need to take that break to do that, please. That is absolutely the only thing that I want for everyone, is just to be themselves during this time. And this is something I always do as a trainer, but I always debrief with someone after a training. So if you could just reflect right now, again, you can write something down on a piece of paper, but write someone's name down, whether it's a friend, whether, you know, it's someone who is in your home, someone who you can call. Maybe it's you going to the park afterwards, right, and debriefing at the park by unwinding. But just take a moment right now and ask yourself, who's someone I can debrief with? Because we're going to be moving through a lot of information, through a lot of perspectives in this time. So as everyone's doing that, I just want to say again, thank you for, you know, being patient with me and reviewing this self-care, but I wouldn't do this training without slowing down and doing this first. And as you're writing that name down, keep that piece of paper. Please keep that piece of paper, because we're going to move forward with the next slide and do a mindfulness moment. So this mindfulness moment is blank, right? There's nothing on this screen. And there's intentionality behind that. With this mindfulness moment, if you have a sheet of paper, right, where you wrote someone's name down who you can debrief with, keep that piece of paper. If you don't have paper, right, you can make a mental paper, right, your mental mind, or you can stretch, right, you can get up and stretch. But I just ask for you to write on that piece of paper or in your mental list, what are all the things that are on your mind? It can be the emails that we have to send. It can be all the tasks that are incomplete. It can be the things that we have to do outside of work. So just take a moment right now and really think through, what are all the things on my mind? And do this at your own comfort, right? Do this at your own pace. And I just want to do this so that before we start today's presentation, we can see where we're at, what we're balancing in our mind. And if it helps for you, it helps me of just taking that deep breath, right? Of taking that deep breath and just recognizing, what are all the things that are racing in my mind that I don't really see until I write it down. So I'll give people a moment to, you know, write those things down, write that list. I'm writing it too. And it doesn't have to be a full list, right? I know we're only on Tuesday and we still have the whole week ahead of us, but really right now in this moment, what are the first things that came to your mind? And as you're wrapping that list up, right, you got some things down, and that list can definitely be longer or shorter, but I just want you to say, if you feel comfortable, looking at your list, looking at your mental list, and just saying thank you. Thanking your mind, thanking your body for reminding you all the things you have to do that are coming up, for, you know, keeping you responsible, you know, for trying to be helpful with us. But let's just tell our list, thank you for your help. Thank you for your reminders. But right now, I'm just gonna sink in. I'm just gonna land. I'm gonna clear my mind like this blank slide and just decide what I want to get from this training. I'm going to listen to what I want and need from this training. And I'll see you later. I'll see you later list. And just putting that list to the side, thanking that list, right, for all the helpful reminders it's giving us. But right now I'm here, right? And right now you get to decide what you want from this time and what you don't want, especially. So this is a mindfulness moment, and I hope it was helpful for audience members, right? For you who are here. And this is something that we can do for ourselves, you know, before we start our days, you know, before we go into a meeting, or when we clock out of our, you know, homes. I know a lot of us are working virtually, you know, so we can do these things, right? Of like cleaning our plate, clean slate, before we transition to next activities or before we leave something and transition to something else. And we deserve a clear mind. We deserve opportunities to put things on a bookshelf, right? So let this be a personal bookmark where you get to see where you're at, what you've read, what you've done, but now you get to close that book and do something else. And you know where that book's at, you know where that bookmark is at, you know where your list is at, and you can allow yourself to sink in. So I was just explaining that mindfulness moment so you know where I was coming from, the intention and impact that it can have, and how we can use this not only personally but professionally, and can model this moment with our students as well to help our students, our community members ground themselves, build routines, build traditions of how do we gather, how do we meet when we're meeting virtually, and we're coming from such different perspectives, different places. So that is me walking through this mindfulness moment, and I just want to say thank you for participating. And now that we put the bookshelf on the shelf, let's start this training. And I really appreciate everyone for doing that with me. And before we start, I think language is super important. So we're just going to do a vocabulary check of what is coronavirus and COVID-19. So what we're talking about with COVID-19 and why we're not saying coronavirus is that coronavirus comes from an umbrella of large family of viruses that has caused other illnesses, right? Like MERS and SARS. And what we're talking about here with COVID-19 is the most recently discovered strain of coronavirus. And just to be very specific of what that means, the CO stands for corona, VI stands for virus, D is for disease, and 19 is for 2019 when it was discovered and impacting our world. So that is more a very brief science part of like the meaning behind this term. We're also going to talk about the words we're using socially, right? We have words like self-quarantine, isolation, social distancing, and I'm not going to get into the specifics of each one because they're right here and you're going to have access to the slide and this recording afterwards. But I just want to give a very brief example of how isolation, going into this training, isolation and social distancing can be a form of trauma, can be traumatizing for some and for many of us. For example, I'm thinking about individuals who were formerly incarcerated in prisons or jails. We can think about how our society separates and removes individuals who are seen as criminally guilty through a legal process and other ways, and we separate and remove community members by placing them in jails and in prisons. And with that isolation, right, we can feel like that again. So I've interviewed and have met individuals through this role who have been formerly incarcerated and share that they're back in that mental space, even though physically they're no longer in jail, they're not on probation, they're not on parole, but yet those two realities are colliding right now with isolation and social distancing, and it's bringing that past back up, even though the present moment is very different. So when we're talking about vocabulary, these terms, the impact that they can have, we're going to be talking about this from a personal, holistic perspective. We're going to be talking about trauma as a process, as a reality for many, but how it's individually lived. So that's just one way I'll be doing that in this presentation, and I just want to provide that example so I can give you a heads up of how I'll be moving through this information as well. And we can move forward to the next slide. Thank you for that. And I just want to say if, Ashley, if there's any questions right now before we transition to talking about the traumatic impact of COVID-19.
No questions at the moment. Just a heads up for those of you who might be having issues accessing the slides, you can go to handouts and you'll find that there is a PowerPoint there that you're able to access.
Cheers. Thank you, Ashley, and thank you, everyone. So now we're really going to dive in, right, and talk about the traumatic impact of COVID-19. And with this, I think it's really important that we slow down, and I'm going to be on this slide for a little bit, okay? So if you have any questions, any examples you want me to work through, please share that and we'll definitely review those questions or feedback. So what we have here in the slide is a definition of trauma. And this definition from trauma comes from SAMHSA's 3 E's definition. And I'll just read it out loud very briefly. But when we think and talk about trauma, we're talking about it as an event, a series, an event, or set of circumstances that is experienced, something that's lived, something that happens by an individual as physically or emotionally harmful, as well as life-threatening, that has lasting adverse effects on an individual's functioning, mental health, physical, social, emotional, and spiritual well-being. And I just want to move through this slide a little bit more because that is one definition, and that definition is great landing ground. But what does this information mean for us? How do we work through this information as service providers, right? We lost the slides very briefly, but we are back, so this is great. And we have closed captioning, everyone. So if you prefer closed captioning, is right there. But as we're discussing trauma and how do we move through this information, we can start with this first E with events. And traumatic events can look like so many things, right? It can look like incarceration, just like what we just discussed. It can look like domestic violence. It can look like gun violence. It can look like poverty, racism, discrimination. It can also be things that are not only physical. Traumatic events are just physical events that happen. They can be verbal. It can be emotional. It can be mental as well. And the examples I provided of traumatic events are very direct, right? It's things that happen, but they can also be very indirect. So trauma doesn't necessarily have to happen directly to you. It can happen within our communities. It can happen within our families. But I definitely want to highlight how trauma can happen to our bodies, to us, right? By what's around us. And it can also be felt by our bodies as well. So some examples of indirect traumatic events can be witnessing violence. So even though that violence didn't strike you or undermine your autonomy, witnessing violence can definitely be a traumatic event. Community violence is another form that is traumatic, right? Community violence being historical trauma. What has been the trauma that this community has experienced within this land? For example, I'm thinking about Indigenous communities and the historical experience that they have and continue to have as resistance in this country and as resiliency as a community as well. I'm thinking about racial trauma and how that's historical as well for so many communities, so many individuals who are still navigating that trauma and healing and advocating for themselves. Another example of community violence can also be gender and giving people a warning of sexual trauma that can be experienced. So trauma being a set of circumstances. An example of a circumstance can be your gender. If you are assigned a gender or forced to identify with a gender that doesn't align with you, that can create a lot of internal conflict. And then if you face rejection, harm, violence for identifying with yourself through that gender or your own gender expression, that can lead and influence, right, people being someone who's targeting you, causing trauma in your life, right? So when we're thinking about the event of trauma, this first E, we got to think about it as a context, as an environment of what has historically happened that has led us to this point. And again, there's so much to cover with this slide, so I'm going to be brief, but another form of traumatic event is intergenerational trauma. So things that have happened generations ago, or even the past generation, can still follow us as the next generation in our families and our community members, right? We can still be navigating unresolved trauma, unresolved grief from our families, from our communities. To move to the second E about experience, the experience is so many things. I honestly feel like we can have a whole 6-hour training on just experience, right? Because we can have the experience of what our body goes through, right? How our body might fight, right? The fight, flight, or freeze once we're in that event. And that can be unconscious and subconscious, right? Of what our body does to respond to trauma. How does our mind, for example, not process memories, right? It doesn't record the memories of what's happening in order to protect itself. The ways in which in an experience of trauma, we might freeze. We might freeze and shut down in order to protect ourselves, to survive. And The next thing here I want to say is that, again, there's so much information about the experience trauma can have on our bodies, our physical bodies, our emotional bodies, and the ways in which it impacts, for example, how our muscles tense, our blood pressure, our mind racing, our ability to regulate our own emotions, the perceptions of how trauma can change our perceptions of the world, of ourselves, of people. And that leads into the third Eve of facts, right? About how does this impact the relationship with ourselves, with others, with this world, our behaviors, and how we react. One quick example is if it impacts your perceptions, it's going to impact how you see people. For example, is this person attacking me? Is this person giving me feedback? Can I trust this person? Are they going to, do something like this other person did and how they're reminding me of them? Right? There's a lot of things that can go up with the effects of trust, of autonomy, of moving within trauma and healing as well. And it also impacts the way in which we navigate this world. So I'm using a lot of we language, I language, because trauma is an experience maybe some of us have or see within our work. So I just want to give people a heads up why I'm saying we and I. And just to move forward with the next slide, thank you so much, is if people can share in the chat or asking questions, what are some of the concerns you have regarding COVID-19? What are some things that you're balancing and navigating? And if you can share that, I would highly appreciate it as we move forward to the next slide. And feel free to continue chatting if you want to share, because I'll be highlighting some direct impacts. So continue to share. It's still open, doors open, but now talking about the direct impacts of COVID-19. And again, this training is talking from a very personal perspective and interconnected with the people in our lives. So we have a whole list here, right? There's a whole list of all the forms of direct impact. And I'll be brief with reviewing them to also share resiliency and healing and the ways in which we're transforming this direct impact into growth for ourselves and our communities as well. So I'll be not only talking about the harmful aspects, but also how we're transforming that harm. And that's not directly on the slide, but I'll be definitely talking and moving through that. So the first thing we have here, right, we have health and safety. We have following resources and access. Professional, we're going to talk about that throughout the training later on especially, but also family cohesion, routine changes, and even just without reading the details underneath each list, it's a lot to be balancing, right? It's a lot to be navigating. So with this, if people want to chat, we're definitely going to have some polls that are going to come up, and I'll let you know when the polls are nearing. But just share, right? Or just reflect. What are the health and safety concerns that we have? We definitely have positive diagnosis, stress, discrimination, right? Demonstration being like a few examples, right? Discrimination can be individuals, right, who feel that it's unsafe for them to have their face completely covered because they're being targeted or being seen as like thugs or someone who's a threat, right? Because historically, we see individuals who cover their faces as, hiding themselves. And that's something people experience, right? Something that people experience being racially targeted in this nation. So the discrimination with that, also the discrimination of individuals who are from Asian American or Asian communities, right? Of being told they're responsible for the virus. And I have not family members, friends whose family members, this is in New York City, but have experienced being pushed on the train, being yelled at, being told certain things that are honestly racial slurs. So the amount of discrimination community members are facing and just being themselves publicly during this time is another direct impact that I'm not sure we're widely talking about, right? But that can definitely undermine someone's safety as well as someone's mental health, right? Also the mental health of a positive diagnosis. A lot of people who I know and work with have shared, this positive diagnosis feels like a weight over our shoulders, and it impacts, the decisions that we make that were so simple, right? The decisions of, do I go to the grocery store? Do I go to this gathering? Do I go to this family party? now we're dealing with a lot of risk factors that we have to balance, right? And that really impacts our mental health, the ways in which we think about how our presence can impact the health of others and what's safe, right? We're constantly at the drawing board thinking about these things, and it can be extremely overwhelming as one form of direct impact we are navigating personally. And students and our clients, right, and our program participants are probably going through very similar things or have navigated these things already. And the next thing I just want to highlight here is really resource access, right? Being able to just have the basic necessities of food, shelter, supplies. You know, these are things that are fundamental to life and living, and the amount of struggles of even accessing these things, right? If you don't have a car, if you lost your home, if you're facing eviction, these things are absolutely fundamental to our well-being. And, you know, sometimes we say, well, you know, we are trying to do the best that we can, and I'm failing. I can't access these things. And one thing I just want to share with people who are listening is having basic resource access is something fundamental to our humanity, right? And we're going to be talking about that later on, but the importance of supporting individuals, right? And not feeling shame if we're individuals who need support, right? We shouldn't be shaming ourselves, punishing ourselves, thinking negative or low about ourselves if we don't have the access that we need. And we have to see that resource access is fundamental to our well-being and our humanity. And we shouldn't be guilting ourselves. We shouldn't be blaming groups for needing resource access. Along with the disparity, right, of medical health care, of mental health care, even getting to the doctor or doing an appointment right now is so different. We have all these hurdles we have to navigate. We also might have concerns even going to a hospital and those type of things, right? Mental health. We're going to talk about this later, but the direct impact with our mental health, we might be navigating stigma. We might be navigating, where do I even go for mental health, right? What do I even need for my mental health? Where is my mental health at? Of the direct impact of COVID-19. Professionally, we're going to be talking about this later, but we are balancing so much professionally with losing our routine changes, right? Like on the next part of the slide, feeling exhausted, needing to really work towards separating our private life, right? Our personal lives from our work life, and how those lines have definitely blurred. And we also talk about family cohesion, right? And family is also chosen family. Doesn't just have to be people who are born into your family. It can be people you choose to be part of your family, which means roommates, which means, you know, social connections. And how our responsibilities have really increased during this time as well, right? We're caretaking for one another. If people are parents, single parents, right? Aunts, uncles, right? Chosen family aunts and uncles, we're taking care of our young people. We're taking care maybe of our elderly. Maybe we're doing more grocery runs. Maybe we're helping each other out so that people who are at immune risk, right, or immune compromise, they don't have to go out because we can. But that means we're taking on more responsibilities, we're balancing more things, we're balancing more needs, and that can take a toll on us, as well as the increased time being in a contained space. Right now, you know, we have summertime, the weather is still nice, but still we are losing our spaces. Maybe we lost access to places where we spent time. If you would go to cafes, if you would go to other social spaces where you would be and meet others and be yourself, and those places are cut off, that can be overwhelming, as well as a direct impact of losing space and how that can impact how you see yourself as well, right? And only having a few options where you get to be. And some individuals, I'm also thinking about ourselves and youth participants, we might not have safe spaces in our own neighborhoods where we can be outside, be alone, you know, those type of things can push us to stay inside because outside's not safe. And I just want to highlight that as maybe something young people are experiencing as well, or young people or ourselves can't leave because that first bullet point of all the caretaking responsibilities that we have now. And here we have the education of school-age family members. So it's been a difficult time for education as a whole. right? And definitely supporting our teachers and supporting the amount of work it takes to educate and support young people in their learning process. It's stressful, the amount that parents had to navigate working, supporting their students at the same time, caretaking, other things, right? The life that we had before COVID-19, especially if we were dealing and working through and healing maybe our own trauma, maybe our own mental health needs, maybe the ways in which we're growing as people. So the family cohesion, right, can feel really tense right now. And we might be learning a lot from one another, but it's hard. This is a very challenging time for all of us. And I just want to highlight here before, talking about routine change really briefly, is this is a really stressful for young people too. I'm talking about children, I'm talking about teens, all youth, right? Young adults, of losing life milestones. We're thinking about prom, we're thinking about graduation, we're thinking about what is, going to college going to look like right now. There's other life milestones and life development stages that have been impacted during this time. And before, we talk about these routine changes, I just want to say that routine changes can be negative, right? Of what has hindered us, what has been limited, what's been cut off. But I also want to highlight the ways we as individuals have embrace, and have braced this impact. How have we seen ourselves? How have we seen the challenges, our growth during these really, really challenging times? How have we identified during the direct impact, right? How have we seen the direct impact by identifying it and then identifying what is the support we need so that we can move forward, so that we can ask questions, so that we can see what's working and what's not helping as much. I'm sure some of us, and if you want to share in the chat or if you have questions, we've maybe in these routine changes also highlighted, what are the new traditions, the new routines that we've made in our lives, that we've done for our families, for ourselves, to ground ourselves, to recover from this direct impact. I also want to highlight that direct impact is seen. So maybe these are all the ways we've seen direct impact, but it's also unseen. And how, just honoring right now, wherever you are, honor what light have you brought into your life within this direct impact. How have you created a life around you, around others, so that you can see these things clearly, or to create that reflection space, right, within this direct impact. And I just want to highlight the resiliency that we're building and the resourcefulness a lot of us have developed, but we also have to balance that, right, with the reality of how difficult all these things are. So with that, if we can transition with the next slide. I also just want to highlight here in the next slide with loss and grief. If we could please transition. Thank you so much. So with loss and grief, I think this is something that is extremely emotional for a lot of us. It's definitely emotional for me and what my family and community has been experiencing. Even the loss and grief of needing to be in shelter in place, needing to transition, needing to become virtual and remote overnight, right? The loss of separation, the fact that we had so much routine, so many things happening, and then that was very much cut off very quickly. So we've lost without closure. We lost without that preparation of what was going to happen because it happened so quickly. And a lot of us, right, through loss and grief, had to gain footing after falling down. I will say I emotionally fell down a few times during the transition, especially in March, right? And learning what is my footing now and how do I rebalance myself. Also, during this time with loss and grief, we might be exposed to the ways that we've had to re-meet ourselves, the ways in which we have to see what has changed, what isn't the same, what has been lost, and how are we grieving through that process. So some direct ways we are grieving, right, is that we've lost people in our lives, people in our community, people who we go to the store with, right, and we used to have conversations with. Loss of being not able to go to the hospital, for example, not able to have funerals or celebrations. And even if we are able to do them, they're not the same, right? Even if we have access to these things, it's not the same as they used to be. And we don't know what it's going to look like moving forward. And that loss is also compounded by that grief. And those are just some direct examples, right? But the loss of a job, we have over 30 million people in this country who have lost a job. And a lot of us who need to work, right? And we need to work for that income. Losing a job, right, can impact us not only financially, but emotionally and socially with what am I going to do for next month? What am I do to pay for things, right? All of these things are also sometimes out of our control. A lot of people lost their job without a choice, without a closure, very abruptly, right? Not having the ability to financially plan or save. And people who have also lost their savings. For example, my family, we've lost some people, right, from extended family and helping out, right? Helping out with the funeral cost, those types of things. And maybe more families are navigating more losses of savings or financial planning, right? And this part here about grief, there's a lot of ways that we're grieving, and I don't have a definition for grief because with grief, it's that emotion, it's that space in between our body, our mind, our heart that is so individual and unique that there isn't a definition. So if it means you reflect and process what does grief mean for you after this training, please do that. Please do that for yourself in a supportive space, of course. And we're grieving one, the way of life, how our life has radically changed. Planning for our future, right? Maybe we had big plans of getting married, right? Or like moving into a new home or changing to a state. Other things, right, that young people also had for their planned future has been taken out of our hands. Life celebrations are other things that have radically changed, as well as change of plans. And before we transition to the next slide, I just want to highlight that with loss and grief, the importance of forgiving ourselves and seeing ourselves within this emotional difficulty that honestly sometimes feel like we're climbing a mountain. And if you feel comfortable, right, and this is just something I want to share as something that we can do to care for ourselves and our resiliency, is how are we allowing ourselves, how are we creating space, how are we trying to allow grief and loss to move in our lives, right? How are we not bottling this up? Because it will manifest in other ways, right? If we don't address, see, recognize how trauma, loss, and grief have shown up in our life, is staying within our lives, right? And how are we processing it either individually and together? And we can think of very small ways of how do we want to see loss and grief. And again, it can be super small ways of just telling yourself, I am allowing myself to grieve. I am allowing myself to see this loss that I have. I'm creating space for myself, right, to feel these things and not be negative about myself for feeling these things. One thing too is that we might feel a lot of guilt, and that can be so many different things for everyone. But how do we tell ourselves, see ourselves, and really, really listen? How am I allowing myself to be imperfect? How am I allowing myself to be a learner, learning this life's lessons and what happens in this life? How am I learning to forgive myself? I already mentioned that. And if that feels too strong to say to yourself, and that definitely has been too strong to say for me in the past, we can say, if I can't forgive myself right now, if I can't create space right now, I can forgive myself in the future. So these are just some things I want to share with us of how do we balance loss and grief within the humanity of our bodies, of our lives, of the relationships that we have, and recognize where we're at with ourselves, and what can we envision and give to ourselves, even if it's super small. It can radically help how we move through loss and grief. And before we transition to the next slide, I just want to say, people, it's a lot of information to be taking in. So if you need to take a break, take some breaths, drink some water, right? Look around your room, to ground yourself. Please take the time to do that, but only if you're comfortable, right? So with that, we'll be transitioning to the next slide. And this slide is so important for me because I think as a society on the news, we talk a lot about the coronavirus being something only biological, right? As a virus. But I also want to say that we're navigating a mental health issue. So on this slide, I'm not going to read all of them, but some of these things are things that maybe we were dealing with that were in our lives in the past, maybe a few months ago, maybe last year, maybe still now. And we have to ask ourselves, how is my mental health being impacted? If I'm feeling cranky, right, or irritable, or I just don't have patience, right? I've really lost my patience, or the ways in which I'm talking down to myself, right? I'm blaming myself, I'm punishing myself for struggling, for not having all the energy that I used to. And this can look like a lot of things, right? I'll be vulnerable right now and just share, with my mental health, I'm really balancing the fear for my loved ones' lives, right? And how that for me can increase nervousness, right? It can increase the ways in which I can overthink things. And when I'm in those moments, I see and I ask myself, like, hey, Jocelyn, where are you at emotionally? Where are you at physically? How is your body doing right now? To kind of bring myself back, because fear, anxiety, the mindset, right, of like, I'm just trying to survive and make sure my family survives with me, my community lives with me during this pandemic, they can take us super far away from our physical body, our physical space. And by doing this, right, by recognizing how my mental health is being impacted, one thing I just want to share with people is really be kind to yourself, really ask yourself, how have I balanced this? How have I been navigating this? Right? We want to be patient, and I would even say loving with ourselves, because we're balancing a global mental health crisis as well. And this overlaps with the physical aspects of this crisis as well. And we have to give ourselves that grace right now, right? We should be patient and identify, what is the support I need? How have I been honoring myself, seeing myself even in my lows, right? These things might seem really small, or small things to say for ourselves, but as micro promises, micro changes that allow us to see ourselves, not blame ourselves for feeling these really human things. None of us have, I will say, maybe this is a very, very, very assumption, right? But none of us have lived through a global pandemic on this scale for over 100 years. So be patient with yourself. Let's not punish ourselves for this moment. And let's jump into ourselves, right? And ask ourselves, what do I need to care for my humanity? How can I be honest? And how can I be genuine? And that might not feel great all the time, and it might be overwhelming. So one thing I offer to everyone, if you know how to drive, the first thing we learn when we're learning how to drive is knowing when to push the brakes, right? When you're learning how to drive, it's not about just going forward, pushing the gas. It's about knowing when you need to slow down along your road. It's knowing when you have to pull over. It's knowing when you're focused on the road, or if your mind's not focused on the road, and asking yourself, maybe I need to take a break. Maybe I need to eat something. Maybe I need to use the restroom. So something I ask for everyone, right? You don't have to do this, but asking yourself, how do you apply your own breaks in life during this mental health process? What's been helping you? What helps you know that you need to take a break? What helps you see when you're exhausted? And some support could be really helpful right now. And this information is going to be shared. There's also handouts that really work through and explain the mental health crisis, and that's in the handouts in the bar on the side. And I just want to say thank you for everyone for letting me really walk through how coronavirus is triggering a mental health issue. And we're going to move forward to the next slide with common responses to our global pandemic right now. So these two slides that we just saw are highly interrelated, right? We might be, as a mental health reaction and issues, we're balancing worry, anxiety, fear of the unknown in general, right? This is just like an atmosphere, right? The tension in our society right now, when we step out of our homes or when we step into our homes, there's a lot of worry, there's a lot of fear. We can feel that we're on edge, right? We can feel that we're hopeless, that we just don't care. And those are ways in which we build walls to protect ourselves. And one thing I want to highlight that might come up with like young people that we work with or program participants of all ages is that as part of experiencing trauma, right, our experience of trauma from a traumatic event, we might put up walls, we might distance ourselves not only from others, but from ourselves to protect ourselves from disappointment, to protect ourselves when failure happens, we didn't have our hopes up. And we might be experiencing now as adults, our youth participants might be experiencing that as well of, I need to protect myself, I need to put boundaries up that push not only other people out, but shut me down too, so that I can stay low and have this coverage for whatever happens next. So me being hopeless is me protecting myself when things don't work out. And that can be happening to us as adults as well, right? So when we think about the trauma reactions or the trauma behaviors we might see with youth participants of all ages, right? Or young people, we can see those things in ourselves and be able to identify, be able to relate, be able to be compassionate, vulnerable of even identifying those things to begin with. Some other common responses that come up is, feeling detached, feeling really surreal of what is really happening right now, as well as feelings of angers, right? So feelings of angers are very real emotions when we think about the context of living in communities that have been historically disadvantaged due to lack of resources. That has been systemic inequalities, racial trauma that we talked about earlier, that historical trauma of what has brought communities to this point of not having these resources, right? And then if that's magnified by oppressive systems and the lack of consideration, right? So if others are living historically in communities that have been denied resources, that have been impacted by oppressive systems, that have made sure those resources weren't available or self-sufficiency wasn't available or given or available, compound that by discrimination and racism communities are feeling at the same time, this is compounded trauma that I'm talking about right now, and those feelings of anger are real, but how do we move through that anger as well and not deny program participants, community, that anger, but helping them channel it, right, as a common response of what is happening. And a lot of people are angry for a lot of reasons. Another thing too is that how do we balance conflicting values, right? How do we balance what we used to do with what we do now and how these things feel like they're colliding? Another thing too is that we might feel stressed about what am I really doing and what can I do? So we might hear some young people say, what's the point of life? What's the point of me being in this program right now? What's the point of me graduating? And maybe you've heard other things, right? But with these common responses, we want to be able to also ask and see and honor ourselves of, this is a really difficult moment. All of us are just being learners, trying to learn this world and what it is right now. And how do we create space for us to feel our vulnerabilities without rushing, without punishing ourselves? And realizing trauma is a lot to navigate, and so is healing. And both those things are not linear. You might feel like you're really moving forwards, you're healing, and then falling back, right? And it can feel like a very tumbly road, right? With the common responses and how do we move forward. And like this image we have here on the slide, you have all these emotions happening and they're pointing you in all these different directions. And all these emotions are in you too. So it's a lot to be balancing. So how do we give this patience, this support to young people, to ourselves, and the issues that we're balancing, right, with our own lives? These are issues our clients are experiencing too. So we're going to be providing examples of how to do that, but it's really important for us to think about ourselves personally, because we need to care for ourselves, our well-being, recognize our stress and our triggers. Because once we do that, when we're working with others, we know what our foundation is. We know what we're struggling with and how that shows up. And not that that has to be perfect. We can be imperfect about it, right? We're learning this moment together, and then giving that grace, giving that compassion, being empathetic, right? Of how our experiences can parallel or have parallel with the young people or clients that we're working with too. But just thinking holistically of we're all experiencing trauma, and how do I be patient, forgive, allow others to be in this moment with me too. So one, thank you everyone as we transition to the next slide. And in the next slide, what we have is really talking through resources. So everyone's going to have access to this. And I think resources can be a lot of things, right? One, you have my email, so I can definitely be a resource. But thinking about with our young people, thinking about our community members, how do we build community and engagement during this time? So yes, we could reach out to crisis resources, but we can also think about how do we facilitate dialogue? How do we share information through our communication with our families and young people without triggering them, or really trying our best to not re-traumatize families, right? So one example can be giving content warnings, right? Of we're going to be discussing or we'll be reaching out, and we might ask for this sensitive information. What support do you need? Is there anything I should know before that call? With our young people, right? We are also a resource for them. So creating a safe environment for people, for our young people, to know that you're consistently, honestly available, you being transparent about what is a support, what can you do and what can't you do, right? And putting that up front so that young people, families know the landscape of your program, of the expectations, of how communication works or is available. And then they get to decide, right? By having this information, us as a team, as an organization, taking these preventative, proactive steps, as well as getting that feedback to improve the landscape for everyone, so that families and young people say, hey, I'm able to look out far in this program with the people who are in this program and see what is available, being able to look out and see the field, right? An entire field of what is this supposed to be? What are the decisions, the real choices I have, and the resources that are available here. So that's just one way I'll share how we as a team can connect with communities, build those relationships, support that engagement as we're moving forward, and have probably done these things during this time. So one, thank you everyone for that as we transition to the next slide. And I also want to, be honest that there is a lot of personal impact, professional impact that we're balancing as well to the professional impact. So this is something that if people want to participate, we're going to have a poll. And that poll is what has impacted you about working remotely. And that'll be popping up in a few seconds of what has impacted you about working remotely. And as that's getting set up, I'll just mention I'll just read the slide, sorry. Oh, we have the poll up. So the poll is what has impacted you about working remotely? Select all that apply. So it's a lot of things, right? We can feel unprepared, right? Maybe we felt super unprepared about working remotely. Maybe we felt overwhelmed during this transition period, unsure about the impact, right? Long or short term. Maybe it's unclear of how we've been impacted due to inconsistent communication or expectations.
We're going to give everybody just another 5 seconds to complete that poll, and then we'll show results. Responses are still coming in quite quickly. All right, we'll go ahead and close the poll.
Thank you.
And share the results.
Okay, one, thank you everyone for participating in this poll. So we're across the board here, right? It's maybe one of these things, all of these things, and I think there could be more poll options. But feeling unprepared, right? This happened overnight, and I just want to say that organizations can experience trauma as well. And there is also workplace trauma that we didn't dive necessarily into in this presentation, but workplace trauma is definitely a form of trauma that many of us have probably experienced or have witnessed with our family members, our community members. And then that feeling unprepared, right? Of this is new. How do I navigate this? How do I even do my job when I used to do it in person? If we're especially working with communities and people and young people, doing things through a screen is very different than how we were doing things before. And it can also be exhausting of being unprepared. So being unprepared can lead to exhaustion because not only are we building ground to cover up the gaps, but we don't know and we don't have bridges to transition from a virtual to a virtual space from a physical working environment. So one, thank you everyone for participating in that training. And as we transition to the next slide, I just want to highlight, I'll just leave this healthcare work statistics as a background if you want to read through it, because this is really a historical perspective of how pandemics can impact the healthcare fields. So just highlighting how industries, right, entire service provider systems are impacted and have been impacted in early 2000s, as well as early COVID-19 studies from China. So I'll leave it on the background as I talk through some information. I just want to highlight as professionals, the impact that we're balancing is that we're all under increased stress. And it's very noticeable that we're stressed and especially stressed out. We are attending to many things. For example, practical things of how do I do my job now, right? What resources, office supplies, even conceptually, how do I translate what I used to do and I have to do it, but it's not the same? And how do I build that bridge without having it fall apart, right? What is the support I need? We're also balancing and attending to many emotional things of things that we mentioned earlier, balancing caregiving, education of our young people, loss and grief. And yet when we show up to work, right, we have to show up to work. We have to get all our tasks done. We have to perform. And that can also be exhausting and overwhelming as well, right? With the loss of space, of separation, of being able to distinguish what's work, what's home life balance. And I just want to say that all of us have been working so hard to attend to our clients, customers, students in the best way that we can. And one thing I want to highlight is that when our clients, participants, students are stressed or when anxiety rises, people can also become less engaged. And maybe we've noticed that within our programming as well, right? People are less engaged because there's so much going on at home in their personal lives, just like us. And people, for a lot of reasons, have to think about how do I dedicate my energy, my attention, my focus to those high priority needs or to responding to that trauma or healing from that trauma, that people are less engaged, less willing to participate, right? Maybe they're not showing up their full selves or their full attention span in the sessions that we hold with them. And that can feel really exhausting for us as service providers because we put in so much work to make that program even available and it feels like it's missing, right? So the one thing I just want to say is that when our clients, when our students are stressed out, or anyone as people, when we're stressed out, one of the first things we do is look for someone who is calm and regulated, right? Someone who can be a resource for us. And when we don't have someone who's able to be a resource, who isn't calm or regulated, we might not go to them for support. We might not go to them to be vulnerable. And we might, as individual people, fight, flight, or freeze because we don't have the resources. We don't have the point of contact who is trustworthy or modeling emotional regulation. We fall back on what are our defense mechanisms that we can do to survive or move forward in this difficult moment. And as staff, I also want to highlight that a lot of us have balanced a lot of trauma. A lot of us are probably frightened. A lot of us are probably navigating stress on so many levels. And we need to connect with ourselves too, not only on a personal level, but on a professional level and align them. of asking ourselves, what are the resources that I need? How is fight, flight, or freeze showing up at the workplace for me or with others? How can I recognize my triggers that are new or not so new, and how I can prepare and support myself to navigate, plan around those stressors? How can I prioritize what works best for me? So maybe it's a new work schedule, and maybe it's like a simple shift, right? Of you making sure you have time in the morning to set yourself up, or how you organize your tasks throughout the weeks, and your supervisor and you having a conversation about that. So that time's protected. The other thing too is breaks, right? Being able to have breaks and recover from trauma exposure and our own personal trauma as well, of how are we mentally aligning and supporting ourselves. So that's a lot of information from a professional impact level. And I just want to share with the next slides, what are some direct tools that we can use. So these are going to be apps that are available. I also will give alternative options to these apps, but this first one is on resiliency, right? How do we keep ourselves emotionally balanced and emotionally healthy? So maybe it's in this app, right? They talk through, how have you taken time off? How are you assessing your compassion fatigue, vicarious trauma, burnout? And burnout, I just want to be very brief. Burnout is when our workload does not match the resources that are available, and we're exhausting ourselves, right? We're pushing ourselves to cover that gap because those resources aren't showing up or haven't been available, and it's draining us a lot to that point. And burnout is something that happens across fields. So I just want to highlight that as well. So this is an app that is available, and I just want to highlight some alternatives very briefly. You have this as a resource, but it's labeled as coronavirus impact scale. So we can, take that time back, do this in an emotionally safe environment for ourselves, for our clients and participants, but really be specific, right? Again, in a safe environment, how has coronavirus directly impacted us? And those questions ask, like, how has it impacted your routines, your experiences to stress? You can also add your own questions, right? To really highlight this resilience aspect, but what are the strengths or perspectives you've gained during these past months? How have you recognized what is supportive of you and what doesn't support you? How have you seen the ways in which you overcome or balance stress? And it's not to be like positive, right? Like, let's just be positive to work through this difficulty. It's being honest with ourselves of what's been working and what hasn't. And that's an alternative to this app. You can also use both together. In the next slide, we have another app that's called PTSD Coach. And this app in the next slide really provides information on education on PTSD, information about professional care. It also has a self-assessment on how to manage the stresses of day-to-day life or daily life. One thing I want to highlight here, you also have a resource as an alternative to an app, or you can use both or all, but it's called Tolerance Workbook. And it's how are we building tolerance during this time? How are we building support for ourselves during this time? And that workbook is just that. It's a workbook with very specific examples, strategies, tips, reflection questions for us to have. One thing, for example, is if you know you're going to have a stressful week coming up, and maybe we don't always know that, right? We don't know when the stress shows up, but they have like a daily planner tool of what can you see happening in your day? What are things that you know can stress you out? What are some ways you're going to balance and take breaks for yourself within that day? And it's a one pager. And that's just one of the many tools within that workbook that is similar to this PTSD Coach app. And in the next slide, we have another app too that we want to highlight it's called Heart Rate Free. And that app in the next slide really helps us understand our pulse, our heartbeat. One thing, again, right, experiencing trauma or being stressed or toxic stress impacts our body, and we don't realize that all the time. For example, when we're stressed out, when we're dealing with toxic stress, when we're in a traumatic moment or in a traumatic experience, our heart races. It's pumping blood to certain areas in our body so we can prepare to flight, fight, or freeze, right? We might notice that when we're stressed out, we feel our heart race, we feel our blood pressure race. And that can fasten our breathing, right? Our lungs have to pump more oxygen in to support that blood flow. And with this heart rate app, right, this is one option for people, but we can see how our mind and our heart race together, and how when we slow down our heart, when we slow down our breath, we can create emotional or mental clarity for ourselves. And an alternative to this app, you can use the two resources I just mentioned that are in the handouts. And another example is that we can ask ourselves, like, okay, how is my heart doing, right? Like emotionally, how is my heart doing? Do I feel connected to my heart? Do I feel stressed out? Do I feel that I want to jump out of me? And those are stressful things to be balancing, right? So what are some activities that we can do for ourselves to help our heart slow down? I'm just going to mention a few. I'm not really going to explain them, but one of them is, meditation. And meditation can just be for a minute, right? It doesn't have to be an entire exercise because that can be overwhelming, but just taking a minute where you do nothing and just slow your breath down, or go on a walk, or look outside of a window, right? These grounding techniques, listening to your favorite song, right? And really breathing to that song, dancing to that song. There's also breathing exercises, stretching, looking up at the sky. And the handouts that I just mentioned have so many more examples, but there's alternatives to slow our heart rate or know where our heart is at, as well. And I just want to highlight that our heart is one of our many life forces. So when our heart is racing, when our mind is racing, when our body is ready to fight or flight, it can create a lot of stress, internal stress, that becomes physical, emotional, and mental stress. And how do we balance those things out, right? How do we balance our external reactions to the world to our internal reactions, and make sure that our mental intelligence and our body intelligence are in communication with one another? And even just starting that conversation, right? So those are a lot of tools that we have and that are in the handouts. I just also want to say that in our next slide, it's going to be Q&A. Very brief, we probably do for like a few minutes before we talk about coping mechanisms and self-care. And I just want to check in with Ashley if we have any questions, any feedback, anything kind of going on.
At the moment, we have not received any questions or any feedback. But like Jocelyn said, if you have anything that you'd like to contribute, please feel free. Oh, great. There is a question that just came in. It says, will these handouts and slides be emailed to us as well? Yes, they will. Great question.
Yes, definitely. And I also feel like the tolerance workbook is one of the ones that I mentioned. That one's a lot of pages. So you can also go through the handouts at your own pace, at your own speed, right? And you can also share some of these things with your teams, with your family members. I've shared this information with my niece who's 9 years old. And that was specifically the tolerance handout. So we use the daily planner to build routine into our lives, because our routines really fell apart, right, with staying at home and shelter in place. So I've moved through that information, but you also can build off that information too, because all of you are experts within your roles, within your community, with your youth as well, right? The youth that you work with are also experts. So you can co-create what these handouts look like in specifically what you do. So I just want to highlight that too. I know that was not a question asked, but I just wanted to share that with what these handouts can look like moving forward. Well, thank you everyone for that question. And as we now talk about coping mechanisms and strategies, we are in the first half, right? We're halfway there with the webinar and training. So please feel free to ask questions, any clarifications. This is your time and I want to honor that time. And again, all of you are the experts, right? So if there's anything you want to walk through or share, please do so. And this section here is really going to focus on how are we coping and how are we looking after ourselves, right? So I'll be very brief with reading off the slides so that I can talk through some examples. But this slide here is very specific, right? Between coping mechanisms and self-care. And I just want to pause and highlight that coping mechanisms and self-care are different. They're definitely related and support one another, but there's really a lot of distinctions between coping mechanisms and self-care. For example, I'll again read off the slides. With coping mechanisms, it's strategies that we use when we face stress, right? So stress that pops up, stress that we weren't, thinking about, we weren't planning for, or maybe it's stress we're familiar with. These strategies can also be used in the face of trauma, right? The trauma we have experienced in the past, trauma that is lingering or ongoing, like chronic trauma, sustained trauma, or the ways in which we're healing from trauma. And how do we use coping mechanisms to help manage, right? Manage painful or difficult emotions in that moment. So you might have your daily go-to tools, right? Maybe it's you take the break, right? Maybe it's you pause and reflect before, saying something in response, right? We also have ways in which we all individually relieve our stress and improve our mood. We also might have quick fixes to remedy the situation so that we can move forward. And then self-care is different. It's a little different because we're not necessarily in the heat of the moment. We are in kind of our own space where we're taking intentional action to care for ourselves, right? And to care, another word for care can be advocate, can be to recover, to heal, to rejuvenate, right? Our physical, mental, and spiritual, emotional health. So when we're talking about health, we're talking about long-term you. We're talking about present, past, and future you coming together and connecting those three dimensions of you. And you might have other dimensions you work through, right? Of not only your present self, your past self, your future self, right? And you might have more identities and categories that relate to your self-care, but really this is your space where you look after you, grow you, and honor yourself in these long-term ways that connect to your coping mechanisms. But again, these are very distinct things. So maybe you have a schedule, right? You have long-term planning of what does self-care look like for me? How's that individual for me? How that gets to change too over time. For example, we might have the goal of with self-care to really prevent and restore ourselves from stress. So another way I like to talk about self-care is self-recovery, right? How do we recover from trauma exposure? How do we recover from workplace stress, life stress? Right now we're dealing with a lot of societal stress. So what are ways that you can see future you and future you looks back at you and build this time in between through self-care? And also self-care, it's what's your motivation? What's inspiring you? What keeps you going is another way of thinking about self-care and making sure that's at the forefront. To give an example, kind of more of like a metaphor of like what's the difference, I'll give two. One of them is with coping mechanisms, we can think about it as tidying up, right? Let's say our home's a little messy or things are a little bit out of place or someone put them out of place and we're putting things back on the hanger, kind of shuffling things into the closet or a chair where we just pile things up and we're just tidying things up, right? Out of sight, out of mind. We're kind of just putting things in a certain place and clearing up a space, right? But we're not really putting those things away. We're just shuffling them off to a chair or to a corner, or we're just keeping them out of sight, out of mind, like I just said. However, when we do self-care, a metaphor for that in comparison could be when we declutter, right? When we deep clean. So deep cleaning is intentional, it's reflective, it's holistic, it's asking ourselves, okay, I'm pulling all the things out from my bedroom, my closet, my clothes, and really thinking about, do I really need this? Is this really serving me? Is this helping me? Do I no longer use this? Is this not helping me with what I'm trying to do moving forward, right? So maybe it's a t-shirt with a bunch of holes on it, right? But we keep it and you never use it. It can be an opportunity to be reflective, holistic, and ask, does this support me? Is this something that I use in my present life? What did this mean to me in the past? How does that past influence me now, and what this means moving forward in the future? And that deep cleaning, right, that decluttering process is not tidying up, right? We're not shuffling off for later on, and that's not bad or negative, right? But decluttering is really creating space. It's reviewing kind of everything. And after reviewing that stuff, right, and like maybe we donate stuff, maybe we give it to someone else, right? We can create space to release what's no longer serving us, what was taking up space, right? What was kind of blocking that closet, or things were too jammed up. And we can also, right, with decluttering, ask ourselves, what do I actually want to keep? What do I actually want to keep for myself, in my home, in my space? And sometimes that can be really overwhelming. I want to say self-care can be really overwhelming. So you can declutter and declean at your own pace as well, right? Maybe you go through one specific section of, maybe I look at my physical health, my mental health, my spiritual health, emotional health, and I decide what that looks like at my own rate. Another example that we can really distinguish coping mechanisms in self-care is like driving. When you're driving, coping mechanism when you're driving is when you're low on gas, and you're always low on gas, and you just quickly put those 20 bucks in, right? Or 10 bucks in, so that you can keep going, right? Until you can park the car when you get home and then deal with it tomorrow, right? You got what you needed, you got where you got to go, and now you're there and you can kind of forget about it, right? But you got there, you did everything that you can, right? We're avoiding the E. And it can be stressful, right? Coping mechanisms can be stressful too, of, am I going to run out of gas again, right? So that's why coping mechanisms are very helpful for the moment. But with self-care, we can think about, okay, how do I fill up this tank, right? If I know I'm going the distance, how do I fill up this tank? And again, this is a metaphor, right? We can also think about, as another form of self-care, when can you walk, right, instead of driving? When can you carpool, right? So when do we reach out for help when it comes to our self-care? Or who are people that we can do self-care with together? So maybe it's a support group. And as well as finding other ways that we can do what we did. For example, instead of driving, you can bike, you can walk, you can ask for support like you would ask for a ride. And these things, again, are really interrelated, but also very distinctive. So I hope these metaphors helped, because sometimes I have difficulty with what's a coping mechanism and what's self-care. So with that, we'll move forward to the next slide. And this is going to be a visual. And in this visual, in the next slide, we have all the forms of coping mechanisms, right? Specifically during coronavirus and COVID-19. So the one that we have up here is increasing our self-awareness, right? Sometimes when we think about our self-awareness, we can think about it, what's bad and what's good, right? And those have very sharp cutoffs of this is bad and this is good. But we can also create space, right, of that awareness of being inclusive and asking, okay, this thing that I see as bad, how does it relate to other parts of me? How can other parts of me that are supportive, that honor me, that help me grow, help me in these other areas where I'm struggling with? And how can I do that in a way that's honoring my full self instead of cutting myself into pieces of what's bad and what's good? How can I be at the table with all these things and support my self-awareness as well as a growth process instead of like a final outcome? How can I see my self-awareness as something that happens over time, not something that has a final result or outcome? It can, but how do I be patient myself with growing my self-awareness in this new time? With taking mindful action as the next thing, how are you giving time for yourself to process, to reflect, right? Another thing with being mindful is, how are we loosening the grip with judgment and assumptions? How are we seeing what is in the moment and being patient with ourselves and others, right? How do we allow our mind to sink and soak in the information instead of feeling it's pressured and rushed to decide on something quickly? The next thing here, and again, these things are talked through in the handouts as well, so I'm moving kind of quickly, but we have here with creating downtime, right? When we're stressed or navigating trauma, how do we land from that exposure to trauma? How do we feel? What do we need? How do we take time for you to be with yourself and connect with your inner self, whether that's coping mechanisms or self-care? Who are the people that you can reach out to and do self-care with, or reflect from, or ask for help when you're running low on gas, right? Or running low on energy or coping strategies. The next part here we have is spreading compassion. So spreading compassion is a very, very individual and unique definition for everyone. And I just want to offer compassion can also be understood as patience. How are we spreading patience with ourselves, especially when we feel rushed and pressure to accomplish things? How are we being patient? And patience can also look like silent moments, right? Where we don't fill in the gaps, where we don't make the conclusions, and kind of see what happens in that moment, or allowing our participants, our young people, our communities to fill in that gap, allowing them not to feel pressured to have a response or to feel like they can't make mistakes, right? So one example is that even, let's say our students, our clients, our youth participants are being disruptive, right, in the Zoom call, and however we're linking up with them right now virtually. How can we slow down as service providers and ask ourselves, what is happening? What is happening in this moment? And not saying what's wrong or what's wrong with you. Even if you don't say that to the young person, even saying that to yourself unconsciously can influence us in certain ways. So how can we be patient? How can we let silence sit in? Right? We can also ask ourselves, by spreading compassion, I wonder what's the function of this behavior? I wonder what has happened in this moment. What is triggering this response? And how do I help this person know that I see them and that I'm supportive and I'm not being judgmental right now? I'm just trying to be here with them by spreading compassion. And this last thing here I think is so important with attending to our feelings is what allows you to see yourself? What allows you to be that person that I mentioned earlier, learning life's lessons, right? How do we give our patience, our respect, our honor to see that we're learning all the time, and in this world especially? And how do we know, right, like in that example that I mentioned earlier, how do we know when to apply the brakes? When do we know when to pull over when we're driving on our road of life? And that importance, right, of before you stop, before you pull over, how do we identify by attending to our feelings when we need to slow down, and either decide to pull over, to brake, to ask for help? So that's a lot of information from this section. And this next part, as we move forward in the next slide, is going to be a poll. So in this poll, and it'll pop up, and I'll just read the question for now. It says, which strategies have been helpful? So what's been helping us during this time? And one of them is reaffirming boundaries with work, living situation, and more. The other one is recognizing, responding to new needs and our capacity. Another is blocking off time and organizing priorities. And the other one is personally and professionally reflecting. And reflecting can mean so many things, right? So in these final 30 minutes, we just want to ask people where they're doing and where they're at.
Okay, I'm going to give everyone about 30 more seconds to answer this poll. Okay, I'm going to close it out and share the results.
Thank you everyone so much. So again, across the board, right, we have all these things that we're doing across the scale: boundaries, responding to new needs and our capacity, blocking off time, organizing, right, being our priorities, as well as reflecting, right? How do we reflect? And I just want to say all these things influence one another too. So I just want to say thank you for everyone participating in this poll. And in the slides, we've talked a lot about like coping mechanisms, self-care, but we also have to talk about some of our pitfalls, right? Trauma and healing are are things that relate and influence one another sometimes. And that's a very general statement to say about such a personal experience. But just like with resiliency, healing, and trauma, when we develop our coping mechanisms, right, our coping strategies, our self-care, we're gonna make mistakes. We're gonna fail personally, right? And we might feel like that, but we're not failing. These are pitfalls that we experience along our road. Going back to the driving example, right? You can be fully on the road, fully attention, know that you don't have to slow down, pull over, or press the brakes, but we see a huge pothole, right? And sometimes we don't see it and we notice it right away when we bump into that pothole. Or we, get angry at ourselves because we hit that pothole. Some things are not always in our control. And again, right, let's be patient with ourselves, or we're going to make mistakes. Allowing ourselves to make mistakes and come back from those mistakes, right? So I'll be honest, some of these things here, right, are maybe some things we've experienced and continue to experience. Some examples here are very specific, but they can be brought in. For example, with avoidance. So things that we have here is like not taking the recommendations of health professionals, right? Because or not only health professionals, but other recommendations from people in your life, because I don't want to acknowledge the gravity of the situation. We can also push away distress, right? How do I avoid what's stressing me? How do I just put that again, right, in a corner? How do I tidy up so I don't really have to clean it or declutter it? And let me distract myself, right? Let me immerse myself in things that are distracting. And these things are negative, right? I'm not saying these are negative things about us. They're just pitfalls, right? They're just things that we do either because they're learned behaviors or because they help us cope in that moment because we're facing a lot of stress, we're facing a lot of trauma, and we might fall back to these habits, or these might be the habits that we're familiar with, right? So it can be being immersed on our phones, social media. Some other things can be gaming, shopping, online gambling. And avoidance can also be how we avoid ourselves. How do we not attend to our emotional well-being, right? Not attending to our emotions. The ways in which we avoid creating downtime. Because if we create downtime, I don't want to reflect. I don't want to think about what my needs are. I have so much that I'm balancing right now. I'm going to lose what I've built, right? I'm going to lose my foundation if I try to create this new space. So this is when we ask for help. This is when we, go into that self-care of who can I ask for a ride? Who can I ask for support? What's helping me and what's not helping me at your own pace and at your own rate, right? Avoidance, like numbing and withdrawal, which we'll talk about next, is a slow process, right? These things don't just happen overnight. They can be built over time. And it's also going to take time, relationships, support, trusting yourself to move through that as well. So with numbing and withdrawal, right, it can be things that we do to escape for our uncomfortable emotions. It's how I remove myself. It's how I disassociate from myself. It's how I reject parts of myself. Or numbing and withdrawal is not only not having feelings, but it can be the ways in which we punish ourselves, guilt ourselves, blame ourselves, right? Of how do I numb myself from feeling feelings? By feeling negative about myself and not having that capacity, not having that grace to allow myself to be vulnerable, to feel, to cry, to be overwhelmed, to ask for help even. And that comes from a lot of places for many of us. Maybe it's how we grew up. Maybe it's the responsibility or the roles we have in our household right now that we have to be the figure. We have to be the head of this household. We need to stay strong for others because they're struggling. So I can't struggle right now. I have to put that aside and numb myself as a way to stay strong. It's withdrawing from my emotional needs because I can't attend to that. And some examples here, right? Those are a lot of examples I provided, but some other examples, right, is drug use, alcohol use, binge eating, excessive sleep, right? But those are just few of many examples, right? And I talked through a few on a more emotional level. Well, we also see anger. We see anger not from an individual perspective, from like a group perspective, right? So we can see how certain groups are blaming communities, right, for the pandemic. We can see how sometimes we have anger with ourselves. Sometimes we're angry at ourselves, and it shows up with how we talk down to ourselves. Maybe it shows up with how we say how we hate ourselves or hate our bodies or don't like ourselves. And that can come from so many places, right? And COVID-19 can just be exacerbating that, or COVID-19 in our current moment is bringing these things up or creating it in new ways. But this can also show up with our family, with our friends, how they're having outbursts, or maybe how we're having outbursts, because we're stressed and it's a toxic stress. And if we lack resources and other things, it's gonna blow somewhere, right? It's gonna manifest somewhere. And the other thing here, the last thing before transitioning to the slide, is we might blame marginalized groups, right, for not social distancing or taking the precautions, because we say, you know, they're gathering, they're doing this, they're doing that. For example, someone who I was having a conversation with talked about in their neighborhood, a lot of people don't have mental health support. A lot of people, you know, gather in groups because that's all they have, right? They don't even have a home where they can be vulnerable, be with themselves, have feelings. So by drinking in groups, even if it's a small group, that's how we cope. That's how we've been coping. And it's really something that they need to do now. So really being human, being empathetic of, we have to see where our coping strategies and mechanisms come from. And when we see others and don't agree with their coping strategies, let's not judge them. Let's understand what's the context and the history of that coping strategy as well. So to diffuse that anger into curiosity and understanding, right? So channeling that anger. And then the next slide that we have is self-care. And we're gonna have another poll about self-care challenges. And that will be showing up soon. And I've talked through self-care throughout this presentation, but it's accepting where we're at. But self-care can also be really challenging. So in that self-care poll, it's going to ask you some questions about what are some barriers, challenges to self-care. And I'll just read some of them out loud. So what are some challenges to ensuring your self-care, right? It's having time and energy. You're not sure, but you're trying your best, right? So you're doing your best, but it's not really working out or working out fully. Barriers in accessing supportive services or spaces, and also messages that we might grow up with self-care, right? So what are some challenges that we have with self-care?
Okay, I'm going to give everyone a couple more seconds to answer this poll.
Thank you.
Okay, I'm going to go ahead and close it and share the results.
Thank you. Okay, thank you so much, everyone. This is all polls are super vulnerable and require us to be vulnerable with ourselves in sharing. So thank you so much for this poll. And we're going to work through some of these challenges in the following slides, okay? And in the self-care slide that we have, it's really talking about our self-care as 3 dimensions, right? Our past self, our present self, and our future self. All of these dimensions and degrees of us interrelate and influence with one another. This is something that I recommend if you feel comfortable and safe. You can do this with family members, with yourself. If you do group support, right, or like youth circles or group activities with youth, asking themselves, right, and you've probably done this already with an identity wheel of what are all the identities that influence you, that connect with you. We can also do that with self-care. What are the ways in which you are seeing yourself, recognize the parts of yourself that influence one another? So one thing I like to say with self-care is that it can be highly inaccessible sometimes, right? If you don't have the time and energy, how are you going to care for yourself long term, right? It's like going back to the car example, right? If you only have those $10 to put in your car before you get to the E, that's all you have and that's what you're going to do, right? So how can we see our self-care as self-choice, as self-advocacy, as self-reflection about what are the strengths that I have? What are the things that I'm able to accomplish where I'm at? What are the things that I'm still seeking, still trying to improve, trying to grow inside of me, right? And with the biggest thing about self-care, especially with ourselves, it's accepting where we're at. It's accepting where we're at in this moment. And sometimes I feel like with self-care, and I'll provide a very brief example before moving forward with the next slide that can really help us move with this information. I think we see self-care as like the ultimate endpoint, right? So an example is like being fit or getting fit or exercise stuff, right? But really with self-care, it's asking ourselves, what does my body need? How can this serve my body? How can this support me? So physical self-care doesn't have to be just being fit or going to the gym or working out. It can be your physical body of what are the slow changes you want to have for yourself. Maybe it's how you take stretching breaks, right? Or it's how you feel, how your body's tensing up. So how do you relax? How do you move? How do you listen to your body, right? It doesn't just have to be working out. It can be, how do I build a relationship with all these dimensions of myself? And how do I do it as a choice, not as punishment, not as talking down to myself? How can I talk about this in the workplace or at my home with self-care, right? So how am I being my own self-advocate? How am I recovering, and how I see and identify how stress is impacting me mentally, emotionally, interpersonal, and physically, right? And this is just one way to see self-care. In the next slide, we're going to talk very briefly about radical acceptance of, if we are doing self-care to accept ourselves and where we're at, we first need to see ourselves and be present with ourselves. This is in the handouts. This is in the handouts for the workbook for building tolerance. So that very big tool resource you're going to have, that's in there. And there's few pages dedicated to this, and I'm going to move through it quickly. But really, it's really hard to do self-care if we don't accept the presence, right? If we don't accept ourselves where we're at and honoring ourselves, accepting ourselves, and not trying to be something that we're not, we need to see and allow ourselves to fold forward, right? And for us to accept that self that's folding forward to us, that is being vulnerable with us, recognizing you and I in this moment, right? It's recognizing what is and what can we do to respond accordingly. It's asking ourselves, what is the amount of control that I have? So amount of control can be time and energy you have. What are the small promises you can give to yourself? Whether it's physically, you promise to give 1 minute where you just stretch, or you breathe, or you just take a mental break. That can be physical self-care that isn't working out, right? Or what your self-care is supposed to be. Your self-care is decided by you and for you. And in the toolkit, right, that I mentioned, they're going to walk through all of it, right? When we're first learning how to accept ourselves, we're really struggling with ourselves. We're resisting ourselves because a lot of society, ways we've grown up, right, our life experience, we've been taught and it's been reinforced how we have to reject and abandon parts of ourselves to be successful, to be socially accepted, right? And we might struggle with who we really are, or who we're getting to know about ourselves. The next thing here, right, and explains the toolkit, is exploring how do we turn towards discomfort. And again, with safety and knowing when to apply the brakes, knowing when to pull over, how do you explore what comes up, what you're resisting, what you're struggling against? And then hopefully over time, right, with this consistency, you're able to safely, right, hold steady of what's not bad and good, but how those two interrelate. How can you do that in a safe way? And then with that, we can really allow our feelings to come and go, be an observer of our own mind, our body, our lives, without being judgmental, without punishing ourselves or guilting ourselves of who we are and how we see ourselves and where we're going. And then in this last part, right, is how do we see the value in a difficult emotion? And this is something that is very difficult, right? How do we befriend? How do we see our emotions, difficulties in our life as a person? How we treat ourselves, how we build a relationship with what's difficult so that we can move through that relationship through communication and understanding and respect. So this is all in the handout, but really self-care, requires the fundamental aspect of acceptance. And this is more information's in the handout. And I know I explained that in a lot of detail, but I think it's really important, right? And we're going to transition to now collective trauma. We're just going to skip the Q&A just for time's sake because we're running close to time. But really, we've talked a lot about individual trauma, how we're coping, how we're moving forward. How do we now talk about the collective trauma where we're at right now? And with the next slide, here is the definition of collective trauma. And again, everyone's going to have access to this. But collectively, right, in our own lives as individuals, in our families, in our communities, workspaces, when we're working with youth or with our program participants, how do we make time to collectively reflect? And when does that feel safe? How have we built genuine relationships and a safe environment for us to share what is collectively happening, right? What are the experiences that are spreading across an entire group of people and how we're suffering from these things too? We have to ask ourselves, right, how can we collectively, whether you're talking about your program or you're in a meeting or you're in an individual conversation, how do we slow down, right? How do we not rush through this trauma? Because this collective trauma that we're experiencing, it's not about muscling through it, right? Pushing yourself to just get it done, get it out of the way, rip the band-aid. I feel like a lot of people say we can't muscle our way through collective trauma. When it comes down to our emotions, trauma, and healing, we need to instead learn how to stretch collectively. We need to move at our own rate, our own process, our own space, right? And we need to ask in our programs, with our youth, with ourselves, what do we need in this moment? What are the priorities? How is trauma impacting us the most? We might not use the word trauma, we can use stress, we can use needs, we can use a lot of different terms, right? But it all comes back to this collective trauma of how do we land, how do we see one another, and you can share at your own rate and your own comfort. It's not about muscling through it. It's about I'm stretching, I'm offering this stretch, this is the ways in which we can move it together, but I'm not here to force anything, right? It's your own reflective process, and how can we do that collectively within our programs? So that is one way I really like talking about collective trauma during COVID-19. And with the next slide that we have, we're going to talk through some examples, right? Of it is collective, but it's also not collective, right? And the collective experience. So there's a collective trauma of COVID-19 being an event, but the experience is very different. And I'll read this slide briefly before we transition of we're all facing the same storm, but we're not in the same boat. Some of us are in yachts and some of us have dinghies with holes in them. And when we move forward to the next slide, we can see this visually. We can see the visual impact of COVID-19 being a storm of crisis. And if you're in communities that have been experiencing crises, not only in the current moment, but historically, whether racial trauma, disparities with poverty, resources, so many things that we can go through. But the crisis of COVID-19, it's felt and lived very differently if you're privileged, if you're marginalized in some aspects through institutions, or if you're destitute, right? Let's say, for example, you have no financial support, and we worked through that example earlier if you've lost your job, how much is cut and unavailable to you, right? And then we live in a society that blames poor people for poverty, right? And the culture around criminalizing poverty has emotional and social and cultural weight for individuals who are in that reality. I just want to say one thing briefly before we transition, but for some of us, we might intersect across these three columns, right? We might be privileged in some aspects, right? But we might have family members, partners, our chosen family who are struggling in other aspects, who might be marginalized, who might be destitute. So just know that these lines aren't always sharp. We might be in some of these boxes in so many ways, which makes this storm of crisis also further overwhelming. And in the next slide, it's a very brief list of individuals who are marginalized right now. So we just want to give space and honor that. A group that is also highly marginalized right now is Native American communities, and how Indigenous communities are experiencing COVID-19 are actually one of the highest groups impacted by COVID-19. So this is just a brief list. This is not an exhaustive list. And some individuals might have many of these identities, right? Or might be in families and communities with many of these identities. And we're gonna go towards the end now with collective care. We're running very close to time at the last 5 minutes. So how do we help each other, right? Going back to that driving metaphor, how do we help each other not run out of gas? Or when we're running really close to that E, how can we be that person who can be called on for support? Or who are the people in our lives that we can call on when we're running low on gas, right? Or even before reaching that point, how can we do that collectively by self-care and not only coping mechanisms? So with the next slide, thank you for that. This is a very brief example of mutual aid networks and how can we mutually support one another. Often mutual aid networks is talked about basic survival needs. And this is information you're gonna have. So not only how you donate your time and give resources for people, but how can we do this within our workplaces? How can we create mutual, transparent, and supportive spaces within our programs as well? So if our students, our young people need food access, mental health access, do we create an environment where people can ask for help without feeling shamed or concerned, right? How can we make an environment where people know that if you need help, that help is mutual? Not only do I want to help or is the help available, we all need this help. So how do we as organizations, as program teams, frame mutual aid within our programs, within our communication, so that people know if they seek this out, they're not being seen as charity, they're not being seen as less than, they're not being seen in a negative way, even if that's not even the environment at all. We don't know all the barriers people might be balancing or scared of before they ask for help. So how do we address all those concerns? How do we address all those fears? And when we're offering help, when we're giving resources, it's mutual, it's transparent, and it's a collaborative network. So we can move these community examples of mutual aid into our programs themselves. And then the next slide, it's just a visual of what are all the mutual aid hubs across our country. Chicago has a lot, and if anyone's interested, I would recommend City Bureau. City Bureau in Chicago has a lot of resources. There's also mutual aid hubs for the state of Illinois that are available and easily searchable online through search engines. And the next slide here is, as we're wrapping up, an example of how one specific community in Chicago has a response team, right? So how are we responding to COVID-19 and need? By being action oriented. And this is just like people who were involved. We can move forward because I really want to highlight this in the next slide of, in our programs and our organizations, how can we identify what are the needs, right? What are the type of calls that are being asked by our young people, by our staff, by our leadership, by the community as a whole? How are we seeing that as a total? So here we have total calls, but we can do this within our services as well, right? In our own organizations. And then what are the things that we complete, right? So what are we able to accomplish with what are our needs? What is our capacity? What is the workload? So that we're not overwhelming our staff, we're not burdening, right? Causing pressure to get these things done. But how do we do this in a mutual way, in a sustainable way within our organization, by looking at what gets completed and what are the actual capacities that we have and what needs to get referred out. So with the next slide, as we finish, it's really asking yourself any questions that you have. Oh, thank you. How can you give back, right? So again, this is intentionally blank and it's blank on purpose of what can you give back to yourself? What are things that you can do to honor and protect the time and the energy you have dedicated so far during COVID-19, professionally and personally? How can you give back to your future self and your past you, right? So how can we holistically look at ourselves during this time before we step forward of what can I give back to my community? what can I give back mutually within support systems? And we gotta take care of ourselves first is really the takeaway message from this slide. And with the last slide, it's a space for questions. And I just want to say thank you for everyone for being part of this training. And again, just thank you again for your time. It's been an honor to reach out with everyone. Here are further readings that we have. And this is things that are going to be available in the slides. And again, just thank you.
Okay, did you guys want to answer any questions? We do have one question that came through that says, I work with youth, but lately they are not engaged. A few of them need psychological help. Where can I refer them? Did you have any suggestions?
So I think to answer your question, I think it'd be really helpful as a team, right, where you work in your organization of coming kind of together, right, in that last example of what are the type of needs that are coming up. So you mentioned like there are certain types of needs, right, and like resources that this person's asking for or that would be helpful. How can we as a team like identify what's close regionally, right, like what's close in our area? Having options because people might not be able to go see or travel to a center right now or be in a mental health office, right, with like a counselor or therapist. So how can we identify levels of, okay, maybe something's a hotline, right, and we have that information. Maybe it's something, you know, we do the research of asking ourselves, let's call the places that we want to refer people with and ask questions, right? So we might have some young people whose language, right, their first language isn't English. So do they have other languages or staff that are available as well, right? So if you find resources, you can think about it as levels of what are national hotlines, regional hotlines. Someone just shared a link as well where you can find all these resources. But as a team, as staff, it's super helpful and also very trauma informed of us reaching out to those places, asking questions, giving our young people, our participants a heads up of what are the expectations when you first call? What are the type of questions they're going to ask? If the young person decides, hey, I might call them, right? Let's prepare them for what comes up in that call because it can be traumatizing when you ask for help, right? And you're not prepared and you shut down or you flight, right? You fly away because you're like, this is overwhelming. How do we prepare people for that referral? How do we prepare ourselves with that information so that we're being holistic? And I understand that can be a lot of work. So this can be an ongoing process and project, but we can also be trauma informed with how we even refer people. The resources there are in the chat box. So I just want to point that out. And let me know if that helps your question. I can also be more specific about how do I identify those needs. Everyone also has my email in the beginning of the slide, so you can always reach out if it's handouts, if it's like webinars, things like that for specifically young people, right? Resources can look like a lot of things. So thank you so much for that question.
Yes, thank you, Jocelyn. And he said that it did help answer his question, so thank you for that. I don't see any further questions coming through, but like Jocelyn said, you have her contact information. You can also always contact our center, the Illinois Center for Specialized Professional Support, and we can direct you to Jocelyn or Ashley for any of your questions. So with that, I just want to thank Ashley and Jocelyn for an amazing presentation. Again, if you think anyone else could benefit from this webinar, we are having the exact same webinar again on the 20th of August with the same presenters, and it will be the same content as well. So if you have any coworkers or anything that might be interested and they couldn't make it today, make sure they go ahead and register and join us on the 20th. And that registration can be found on our website as well. And with that, I just want to say thank you to Jocelyn and Ashley for a great presentation, and everyone have a great rest of your Wednesday.